Hello. This is a webinar recording to assist our families in learning more about pool testing. Presenting today are Deb Malia, school nurse for Saco Schools, and Crystal Taschereau, school nurse for Biddeford Schools. The FAQ section will be moderated by myself, Karen Chassie, and Stacy Nast.
Hi there, I'm Crystal. I'm the school nurse over in Biddeford. Welcome to the Zoom session talking about pool testing and COVID. So to start off, I just wanted to welcome you guys back, the students back to school. We're anxiously awaiting their arrival. We're all excited to be back. And as always, as you know, districts of Biddeford, Dayton, and Saco, we're always committed to following the US CDC, Maine CDC, and the DOE guidance. That's something we're committed to in our districts. We consider kind of, you know, the recommendations and the guidance, and we look through it through a special lens, really looking at the public health of our entire school population and also our community. We know that our students, you know, represent their families, parents, siblings, you know, they're all a part of our community, and we know that the school district is a very integral part of our community. And we really want to help to mitigate that risk of the 10-day quarantines, or even so an outbreak, meaning, you know, 3 linked cases, which could potentially close a school for close to a month. And students wouldn't be able to participate in their sports, in their other extracurricular activities. And we really want to prevent that from happening, or help at least decrease the risk of that happening. As I said before, you know, every time a student or a classroom or a baseball team has to quarantine, it really affects everyone. It affects the parents. Some parents might not be able to go to work. They might have to, it might impact the daycare center where their children go to school, the rec programs for after school. And you could go as far as talking about kind of the taxpayers paying for substitutes. You know, every time a staff member is out, we have to substitute another staff member. So we really are committed to following this as closely as possible to keep our schools open and keep our kids in school. So what is pool testing? So pool testing is the big topic. It's kind of, you know, been brought to us as an option starting in the beginning of the summer, and we've been working very diligently in our district to figure out how to make this a part of our routine come this fall for school. And why are we doing this? Well, you know, we really want to, again, keep our kids in school, keep our staff members in school, and keep all the extracurricular activities going on. We know how important the social aspect is of sports and band and all these other things. So the DHHS and DOE have recommended that we do pool testing to help curb the outbreaks and to reduce COVID-19 spread by detecting it early. We can pool test up to 25 students, that includes staff and students actually, and a minimum of about 5. So those students can be in a classroom, they can be in a cohort, they can be on a baseball team, a football team, they could be on the bus. Those are things that the individual schools and districts will establish ahead of time and let you all know that for the students that will be participating. As far as the details around pool testing, Deb, the nurse in Saco, will go into more detail in a further slide about how that is actually going to work in each school. But just know that these tests correctly identify 96% of the positive tests detected by the PCR. So basically a PCR test is a test that is slightly more sensitive for students that are not symptomatic at the time. Rapid antigen tests have kind of gotten a bad rap. They are very effective tests. It's just that the sensitivity is a little bit less than a PCR test, and they just work in a different way.
So good morning, I'm Deb. I'm one of the nurses for Saco School Department. I'm going to talk about why COVID has affected us all, and we know that it has. And how we do school is different. It's been a very difficult year and a half for families, for schools, and for the students. So we want to do everything possible for our students and make sure that we keep our schools open and making sure that our students and staff are safe. We are very strong proponents for pool testing. It allows us to prevent outbreaks before they happen. It will eliminate the spread of COVID in our schools. Pool testing gives us the opportunity to find the virus before someone is contagious. And what does that look like for our students and our staff? So the kids will come in off the bus or from home. Testing is done once a week in the morning. They'll come into their class either Mondays or Tuesdays, and they will sanitize their hands. They'll grab a swab. They'll swab themselves. One of the questions that a lot of parents have is that, you know, will someone else be swabbing my child? But the answer is no. Even our pre-K kids have the ability to swab themselves. It is also not a very invasive test. They will just go at the very opening of their nose. It doesn't have to be reaching their eyeballs, which is wonderful for these kiddos. Then they will place the swab into a large test tube and sanitize their hands again and go about their day. An entire class can be done in less than 10 minutes. The test tubes are then labeled and sent to a lab in Massachusetts, and those results come back to us in about 24 to 48 hours. If the pool test is negative, the process is repeated the following week, and that will go on every week like that throughout the school year. If the sample comes back positive, and then all those that are participating in that pool, just the particular pool individually, will then all be tested with the rapid antigen test to determine who the person is that is the positive. That person will isolate, and all others that participated in that testing will can continue to attend school because they are under constant surveillance. They are required to isolate themselves outside of school, but no school time is lost. They can still participate in all school-sponsored programs. Participating in pool testing will decrease the risk for quarantine. Last year, as Crystal mentioned, we had schools close here within our districts. We had many kids that were out on 10-day quarantines and families that caused disruption to work schedules. We believe that in-person instruction is the best thing for our students and our families. Having pool testing allows us to do that to the best of our ability. This tool, along with universal masking, is a very proactive tool that allows us to keep everyone safe. We don't know when a vaccine is going to be available for ages 12 and under, so having this program is critical to our functioning as a more normal school districts.
Perfect, Deb. Very good. So the flow chart, this flow chart that you're seeing in front of you now, Deb, pretty much went through all of that. It's a nice visual. I don't, most people are visual learners and it's easier to see. There's a lot of jargon, medical jargon. There's a lot of political jargon. There's all kinds of things that we're trying to kind of mess through as you read things online, but seeing it in view like this makes it a lot more clear. So use this as a reference to kind of augment what Deb had said. So the big question that everyone wants to know, do I need to quarantine? Last year, it seemed a little bit more straightforward, which does not seem to coincide with COVID, right? COVID is not straightforward, but believe it or not, as nurses, it was easier to anticipate who would need to quarantine and who would not. They've done a great job of being able to kind of put this in a table. It makes it look a lot more simple than it really is, just to let you know. By in general, a close contact is defined as an individual who is within 6 feet, and by the way, masking or unmasked does not matter, but within 6 feet of an infected person for 15 minutes or more over the course of a 24-hour period. That's the baseline definition of a close contact, and that has not changed. However, now we have several exceptions, which are awesome because they're opportunities for us to, again, help decrease the risk of having to quarantine and disrupt school and family. So the first line shows you a fully vaccinated individual. So students, obviously right now 12 and up, have the opportunity to vaccinate. So when it comes to being identified as a close contact, if you are defined as a close contact, you would not need to quarantine because you are fully vaccinated, regardless of any of these other items. Also, that goes for people that have tested positive in the last 90 days. It's almost like a window of immunity, sort of a temporary immunity, where you've tested positive, and so you do not need to quarantine from any extracurricular activities, the classroom, etc. However, when we get into talking about pool testing, again, as you can see in the table, they do not need to quarantine in the classroom. From the classrooms that are coming back to school, participating in their normal school day. They do not need to quarantine from their sports, other activities, band, dance, all those other things, because again, as Deb said, there's weekly surveillance happening, which I really like that term versus pool testing. But as far as the community, so when they're coming home, no runs to Target, they should be quarantining when they're at home for that 10 days. Our school districts are also enforcing a masking and distancing policy. So we have put into place a plan where all students and staff members in the buildings are expected to be masked and also maintain a distance of 3 feet or more. When that is in place, students, as you see in this chart, students do not need to quarantine from the classroom at all. Staff, yes, unfortunately do. And there are some more details when it comes to staff that we, discuss with our districts, our staff members. But community quarantine, yes, unfortunately, and then quarantining from sports, buses, and activities. So you can see that coming to school is awesome. Wearing a mask is fantastic. However, it does not prevent you from having to quarantine other than just in the classroom. And then lastly, obviously, if there's no exceptions, like I had said before, you'd have to quarantine. If you're identified as a close contact and you are not participating in pool testing, you have not tested positive for COVID in the last 90 days, it's not going to apply to our district because we are doing a universal masking policy, you would have to quarantine in all aspects. This is, again, some of these situations are very gray. It's much more complicated than what it looks like here in this chart. And that's why the nurses work very, very diligently with their administration staff, the principals, to be able to handle each situation as it arises with parents and students. So I really, truly encourage you to develop a relationship with your nurse at your school. If you're unsure how to contact them or if you haven't met them yet, if you go to your district website, you can go to the school and you can actually go right under the staff contact information and reach out to them and just kind of introduce yourself or ask the questions you need to. You can always, the nurses are very open to receiving emails about questions or concerns and are open to clarify these things if you need that.
So we've reached the question and answer portion. So first question, how can families support pool testing?
I'm going to answer that one. The best way families can support school pool testing is to first sign the consent. You will be receiving consents, and parents need to opt in for their kiddos to allow them to participate. Working together with us, families can be advocates for community well-being. Participating in pool testing empowers you with the data that will help keep your kids safe, as well as the staff and community members. So we're hoping to have the majority of our staff and students participate in this amazing program so that we can keep everyone safe.
Who can access the list of students who participate in pool testing?
I'll take that one, Karen. So first and foremost, in order to participate in pool testing, like Deb said, completed consent forms have to be submitted. We as nurses in the schools manage getting these from families, either using a process we already have in our districts, either paper forms, or we are going to use Concentric's online platform, which I believe that's what we're going to encourage. It's more streamlined. Once they're all collected, then each individual school nurse is going to develop a roster, and we're going to develop the pools. However, the only people that are going to be accessing this information are going to be the people that need to access that information, which would be the principals, the nurses, any health staff assistants that are helping to participate, and teachers.
If my child is positive, will other people know?
The pool testing lab that processes will send those results back to our nursing staff, and it provides a result for the entire classroom. When we have to follow up, if there's a positive, all confidentiality guidelines are followed, and only those that need to know will be aware that the child is positive, or a staff member for that matter.
Can a child who's already tested positive for COVID-19 participate in classroom pooling?
So the answer to that question is no, not if they have tested positive within the last 90 days. They do have that kind of window of immunity, but no, they shouldn't be included in the pool testing. Unfortunately, they could potentially still produce a positive result, and that would obviously impact and affect our process. So no, they would not.
If a fully vaccinated individual is part of a positive pool, do they need to have a negative test before returning to school or work?
As with all the individuals in the positive pool, a fully vaccinated is part, if they are part of a positive pool, they will receive a follow-up test, but it is not necessary for that person to be out of work or quarantine before taking the follow-up test.
How do families receive test results, and how will results be used?
So Concentric will provide the results directly to the school. So they'll come to the school nurses, and the nurses will communicate that with the information with parents about the results. If everyone's negative, everybody's negative, and that's how it goes. If it's positive, only that positive parent will know that their child is the positive student, or the staff member for that matter, like Deb said. And everyone else will just know that they can come back to school as normal. We, as has been said many, many times, and we as a group really want to reiterate that we along with Concentric take privacy concerns very, very, very seriously. And we will do whatever we can to help protect that information and to not have the students' information be shared with anyone that does not need to know.
Thank you, Crystal. Who performs the test, and will there be physical contact with my child?
So as I said before, students are going to swab their own noses, even as young as our pre-K kids. So no, there will be an adult observing the students performing their swabs from a safe distance, but there is no physical contact. And if a student has a hard time performing the swabbing and wishes to have some assistance, there will be either the nurse or a trained staff member that is willing to help them. But it is a very simple and easy, and I think once the kids get into the routine of doing the swab after the first couple of weeks, it's going to become second nature, and it's going to be very easy for them to do this test.
Can a parent of a child not participating in the pool testing program have their child tested to get out of quarantine and return to school?
I'll take that one. Man, that would be fantastic, right? That would make this whole process a lot easier. But no, unfortunately, regardless, a child, a staff member, we're not able to test out of quarantine.
Perfect, thank you. Do individuals in a positive pool or members of their household need to quarantine while they wait for individual level results to return?
The answer is no to that. Staff and students who are part of the positive pool do not need to quarantine while they're waiting for their follow-up tests. Symptomatic students, though, should not attend school. So that's sort of the caveat to all of this. With the weekly surveillance, we're monitoring hopefully asymptomatic people. But if somebody has symptoms of COVID-19, they shouldn't be coming to school anyways, and definitely not while they're waiting for their results. But individuals who are not symptomatic and in the positive pool will return to school for follow-up testing, and then until we determine who that positive test person is.
Does my child have to do pool testing to attend in person? Is it mandatory?
No, absolutely not. We, as we have all said in this meeting so far, we really want kids in school. They do not, it might make it easier for them to be in school and to stay in school if they do participate in pool testing, but no, it's not mandatory. It's absolutely positively voluntary, and nothing will be held against anyone that's not participating.
Why does a school have to meet the 30% or greater participation requirement before reducing the space between students? Where does 30% come from?
So for a school to reduce physical distancing, they must have a minimum of 30% of students and staff participating in the weekly testing. It's sort of one of the requirements of the program. Research shows that participation levels that are lower than that, at 10 to 20%, don't really have a meaningful impact, and it doesn't give the same results. And obviously, as the more people that participate, it allows us to do that weekly surveillance on our max number of staff and students, you know, and that has a real big impact on the transmission rates in our community. So the 30%, and we're certainly hoping for far more than 30% in our districts, because the more kiddos that participate, it establishes a meaningful, you know, more higher level of protection in our schools.
Thank you. Our last slide is a reference guide for all our families to find information from the CDC, DOE, and the Saco Biddeford Dayton school districts. These resources and these presentation that we're sharing with you now will be sent to all the families and available for our community to reference. I want to thank Deb and Crystal and our nursing teams throughout the Unified District for their continued efforts. We are all looking forward to seeing our students coming back in the fall. Thank you.